going to check the patient's orders and their care plan before I enter the room. I'm also going to get all my supplies and equipment that I need. I'm going to knock on the patient's door. I'm going to get some Duramax on the way in, wash out my hands, also make sure I'm maintaining standard precautions. When I enter the room, I'm going to make sure that I close the door and also the curtain if there is one for privacy. Then I'm going to identify the patient by their name and date of birth and also introduce myself as their nurse for the day. I'm going to explain the procedure that I'm doing, which is pain assessment and vital signs today. And then I'm going to raise their bed to the appropriate height for me to do the procedure. So, hi, my name is Ashley. I'm going to be your nurse today. I'm going to be doing your pain assessment and your vital signs. First off, are you having any pain today?
Yes.
Okay, where's your pain located?
It's in my right lower calf.
Okay, what does it feel like?
Feels like an achy cramp.
Okay, when did it start?
It started on my run.
Okay, what time was that this morning?
It was this morning about 8 o'clock.
Okay, did it last the entire run?
Yes.
Okay, so did it occur the whole time or once?
Yes. It started when I went for a run.
Okay. So running obviously made it worse.
Yes.
And then sitting like this makes it better.
Yes, sitting makes it better. I'm not experiencing any pain.
Awesome. Okay. And then on a numerical scale of 0 to 10, what is your pain level right now?
It's about a 4.
Okay. So what I'm going to do is I'm going to check your vitals, and then we will reassess to see what else we can do for your pain. Okay. All right. So I'm going to make sure that her arm is at level with her heart. I'm also going to make sure this is the correct size for her, which it is. This is the normal adult size for adult patients. I'm going to make sure that I put this on her skin and also line up the oh my goodness, the arrows with her brachial pulse. I'm going to make sure that it's not too tight on her arm as well, and also make sure it's an inch from her antecubital site. Okay. All right. So, blood pressure. Put this here. Was 110/64, which is within normal range according to the American Heart Association. I'm going to take this off, and then I am going to check her radial pulse on her arm. While I'm doing this, I'm going to count and look at my watch for 30 seconds. If it is a normal pulse, I will times it by 2. If it is not, I will track it for 60 seconds. And then if it still remains irregular, I'm going to check the apical pulse with my stethoscope. While I'm doing this, I'm going to turn my head and also check her respirations. If they are normal, I can count them for 30 seconds and times it by 2. If they're abnormal, I'm going to count it for 60 seconds, and then I'm going to check for labored breathing. Okay, and then I'm going to take my pulse ox, and I am going to check her SpO2, which is reading at 98%. That is within normal ranges for an adult. I'm also going to stick my temperature probe in the right posterior sublingual pocket to get an accurate pulse, which is reading at 98.4, which is also normal range for a young adult. Okay. So your pain, I am going to make sure that I raise up and elevate her right leg. I'm also going to give her a cold compress, and then I'm going to let her know that I will be back in 30 minutes to reassess her pain, and also ask her if she needs anything else. If she does not, I am going to make sure that her bed is at the lowest level and locked. I'm also going to make sure that her side rails are up appropriately and her call light is within reach. After that, I'm going to dispose of any PPE that I have, also wipe down my equipment that I used. I'm going to make sure that I wash my hands again on the way out. And then I am going to document her pain assessment and how she responded to it. All right.